So it's day 12 of Ellen's keynote study streak, and let us learn a group of remedies today. Hello, Dr. Parul, thanks for joining. So, hope you are seeing all the videos and also learning side by side. Dr. Rishabh, good evening. Uh, you have been part of some courses, so you know the way we are helping all interns and beginners. So let's move on, and today we'll learn group of remedies, especially the mercury group of remedies. Okay, these remedies we saw them as mentioned in Medorinum in the brackets in many places. In Allen's keynotes, you will see mercury mentioned as mercurius and uh, merc solubilis Hahnemannian. So the difference is that the mercurius, which is only mentioned as mercurius, is the quicksilver. Now, by its name itself, we come to know that quicksilver means it looks like silver and it is quick. Like if it spills, it will spread immediately. And it is the original mercury, whereas the merc solubilis Hahnemannian is a combination of having some ammoniums and nitrates, and the symptoms are more or less from the poisonings and less from the provings. So we should mostly depend on the first one. The symptoms are more or less the same, it's not much different. So let's read along, and if you have the Ellen's keynotes with you, it is going to be a very good learning. So mercurius, best adapted to light-haired persons, skin and muscles lax, glandular swellings with or without suppuration, but especially if suppuration be too profuse. The other remedies mentioned are hepar and silica. So we have two remedies which are very close, hepar, silica, and mercurius is the third remedy. There will be cases where you will see that there are symptoms of hepar, there are symptoms of silica, and you are not sure what to give. Think of this remedy in those cases, especially in skin cases, especially in cases where suppuration is there. Okay, one of the interesting things about mercurius is that the swellings or the suppurations are slow to mature. Okay, the next line what we read from Allen's keynotes for mercurius is cold swellings, abscesses, slow to suppurate. So if you have a case of abscess or swelling which is progressing over a period of 8 to 10 days, patient is also not panicking, he is not showing any other doctor also. Think about, and there are very less physical symptoms. Think about mercurius in those cases. Next what we have is profuse perspiration attends nearly every complaint, but it does not relieve. Now does not relieve is given in bold. Okay, this is the first line, first three words that have come in Ellen's keynotes for mercurius as bold. So whatever comes in bold in Ellen's keynotes is one of the very important things. You should keep those things in your mind, register them, and those things will be confirmed 110 times or 200 times and 500 times by patients in the clinic. Perspiration that does not relieve. If you have attended my past few sessions, you will yourself tell me perspiration relief remedy names. Can anyone tell me? If the patient feels better by perspiration, I have told the remedy name twice, and I have also taken a remedy yesterday which had perspiration relief. Yes, so it is, Dr. Purvi is right. In YouTube she is answered. It is natromure and sorinum. So there are three remedies mentioned in Allen's keynotes: natromure, sorinum and veratrum. Profuse perspiration attends nearly every complaint but does not relieve. Even it may increase the suffering. So right, Dr. Rashida Popat, you are also right. It is natromure. So in Kent repertory, when you go to the chapter perspiration symptoms ameliorated while sweating, there is only one remedy, which is natromure. Okay. So whether fever ameliorates, after the fever there is perspiration, it ameliorates, it gives them relief, natromure. If it is normal perspiration after any exertion, after any activity, natromure. If they feel better, it's natromure. Now next we have is great weakness and trembling from least exertion, breath and body smell foul, hurried and rapid talking like hepar, breath and body smell foul like sorinum, tylism, which is increase of saliva, tenacious, soapy, stringy, profuse, fetid, coppery, metallic tasting saliva. So anything that has to do with excess, whenever there is something which is excess in a system, it points towards mercurius. But if you think more ahead, it is something that points towards syphilitic miasm. It is not needed for the body to throw out so many discharges which are also foul. So it is leaving all the waste products, it is giving out all the essential materials, ingredients or elements or chemicals in those discharges, and it is also giving excess. So there are two things that are happening, and three things I would say: salivation, perspiration, smelliness, etc., etc. And then there is intense thirst, though the tongue looks moist and the saliva is profuse. So in spite of having good moist tongue, in spite of having a lot of saliva, whenever you have a patient in your clinics in acute situations who will tell you that my thirst has increased a lot when you ask them the physical general, and when you check them, you will see that the tongue is already moist or there is a lot of saliva in the mouth. Think of mercurius. If there is dry mouth but no thirst, pulsatilla. We know it very well. And sometimes it will be obvious when no thirst patient tells and we check. So if we have checked the tongue before, check it again. When they talk about thirst and the tongue needs to be checked again. Ulcers on the gums, tongue, throat, inside of the cheek with profuse salivation, irregular in shape, edges undefined, have a dirty, unhealthy look, lardaceous base, surrounded with a dark halo, apt to run together, and they are syphilitic ulcers with circular, and it attacks the posterior parts of the mouth, throat, and have well defined edges and are surrounded with coppery hue and do not extend from their primary seat. So you have these patients who will have aphthay, and aphthay will gradually progress to developing 2-3 aphthay, one close to each other, and it will become a big ulcer like a crater. Those craters that you see, that will need mercurius. You will need to give mercurius 200 or 1000 every 2 hourly, every 3 hourly, and you will see the result in 1 or 2 days. So with profuse salivation, ulcers which are huge, large with a big base. Okay. Next we have in bone diseases pains worse at night, and worse at night is in bold. So this means that it is a general feature of the remedy. Anything that aggravates in the evening is more pointing towards mercurius. Going further, we have toothache, pulsating, tearing, lacerating, shooting into the face or ears. So you have one of the very interesting symptoms, and I have confirmed it 110 times, 200 times, 300 times, so many times. Pain starts from one point in toothache and goes to somewhere else, especially in the ear, left side, right side, anywhere. And mercurius is one of the top remedies if you go and read in Kent repertory. Pain from molar tooth extending to ears. It maybe in some rubrics it's there as a singular remedy. So think about merc, keep it in mind when it is mentioned as one of the remedies. Patient is aggravated in damp weather, evening air, warmth of bed, from cold or warm things, and better by rubbing the cheek. Crowns of the teeth decay and the roots remain sound. So the roots are very much in good shape, good consistency, good structure, but the crowns have decayed. This is similar to many other remedies which we will keep seeing, but if the crown is intact and the root is decayed, it is miserium. We read this also in puja. Large flabby tongue which shows imprint of teeth. I need not describe it, you will confirm it yourself in your clinics. But think of other remedies, especially if there are GIT symptoms like chelidonium and podophyllum, and the other remedies rustox. Painful tongue is painful with ulcers red or white, so there will be some red or whitish ulcers, and that can be indicative of more of mercurius. Catarrh with much sneezing, fluent, acrid, corrosive, nostrils, raw, ulcerated, yellow, green, fetid, pus-like, nasal, bones are swollen and aggravated at night and at damp weather. So you see that there is constantly a kind of a discharge which is greenish, yellowish, thick, and night aggravation. If these components are found, think about mercurius. Mumps, diphtheria, tonsillitis with profuse offensive saliva and tongue. Mercurius is one of the remedies. Lachesis, natromycin, taraxacum are the other remedies. Diphtheria, tonsils inflamed, uvula swollen, elongated, constant desire to swallow. So one of the things when you will see lot of pharyngitis patients, ask them if they are able to swallow saliva. If they are not able to swallow saliva, think of heparsal. If they are able to swallow saliva, and ask them if they do it quite frequently, then give Merxol. The membrane is thick, grey, shreds like borders, adherent or free. Going further, we have cough, dry, fatiguing, raking into paroxysms. In fact, it is also 3 sometimes. It's the only remedy in Kent repertory and many other repertories. Worse at night and warmth of bed, utter inability to lie on the right side. It affects the lower lobe of the right lung, stitches through the back, chelidonium and kalicarb is the other 2 remedies. Now, getting a patient who is so much advanced in pathology is a rarity, but if you do get it, think about Merxol, especially in cases where the further line mentions suppuration of lungs after hemorrhages of pneumonia. The other remedy is Kalika. I had once given a very old guy, there was right sided in the lungs, there was some pleural effusion. I had given him Kalika. He was around 75 or 80. So one of the other remedies that we can think of is Merxol. Dysentery, stool slimy, bloody with colic, fainting, great tenesmus during and after, not better by stool, followed by chilliness and cannot finish the sensation. The more the blood, the better indicated. So you see this kind of a picture which is evolving, which says that there is fetid pus, there is yellowishness, there is greenish, there is aggravation at night, there is bloodiness. So this process, sometimes patients will describe you that few days ago it was so and so, it was thin, now it's become thick, and now it's uh, very much bloody. So those kind of processes point towards syphilitic miasm, point towards destruction. Think about Mercurial. Not better by stool is very important. If they feel better by stool, the remedy is Nux vomica. Go in Boric Materia Medica, you will see in rectum that stools ameliorate pains for some time. Nux vomica is one of the top remedies. If they are not feeling better, think about Mercurial. Quantity of urine voided is larger than the amount of water drunk, frequent urging to urinate. So you have these patients who again and again rush to the washroom without no reason. Little quantity they will pass, they will come. Little quantity they will pass, they will come. Think about Mercurial. In female reproductive system, Ellen mentions for mercurius, leukorrhea, acrid, burning, itching with rawness, always worse at night. Again, the same modality comes. Pruritus, aggravated from contact of urine which must be washed off. Sulfur. In fact, what I have seen is that aggravation by perspiration is one of the top modalities for Mercurial. Okay, all the mercurious compounds, in fact. So any skin problems which land up to you, aggravation of complaints by perspiration, think about Mercurial. It can work as a indicated medicine for that time, or it can palliate, or it can be serve as an intercurrent. There is morning sickness in females. Profuse salivation wets the pillow in sleep. Lac aceticum is one of the other remedies mentioned. Mammae painful as if they would ulcerate at every menstrual period. Conam and lac can are the other two remedies. Milk in the breast instead of menses. Going further, we have nocturnal emissions in male which are stained with blood. The other two remedies are Lidam Pal and Sarsaparilla. In the extremities, we have trembling of extremities, especially hands, paralysis agitans. So because of exertion or over depletion of fluids, the body is not stable, and that is why they are also hurried, because they want to kind of overcome that stage very fast. That is why they will usually have trembling of hands, legs, etc. etc. Aggravation is mentioned at night, wet, damp weather. Rust stops is one of the remedies. In autumn, warm days and cold damp nights, lying on right side and perspiring aggravates. I told you about aggravation from perspiration, so keep that in mind. Mercury is aggravated by heat but better by rest in bed, whereas arsenic is better by heat generally, but he is aggravated by rest in the bed. He wants to constantly do something or be on the move. Mercurius follows well after belladonna, hepar, lachesis, sulfur. It is inimical to silica, that is why it should not be given before or after. There may be cases where you will feel that I gave silica and I should have given Mercurial. In such cases, go for an intercurrent in between, like sulfur, according to the miasm predominantly seen, and then give the medicine if the two remedies are inimical. Like for example, caustic and phosphorus, they are very similar. So give something in between and then go for the other remedy. If it is given in low potencies, it hastens the suppuration rather than aborts. This is also exactly similar to hepar sulf. When you go in relationship chapter of hepar sulf in Boric Materia Medica, you will read about when it should be given in high potency, when it should be given in low potency. Bad effects of mercurius are antidoted by aurum, hepar, lachesis, miserium, nitric acid, sulfur, and by a strong high potency of mercurius itself when symptoms correspond. and Miserium is its vegetable analog. And ailments from sugar, insect stings, vapors of arsenic, copper, and diseases occurring in winter. So you have it almost similar to sorinum, although here it is an exaggerated sorinum, I would say. Okay. Next remedy we have is mercor. Now I don't know how many of you are using different mercor, different merc compounds in your clinic, but every merc compound has its own sphere of action. For example, mercurius as a whole remedy works on different parts of the body, and it is working on mostly the syphilitic and the destructive areas, whichever you see. Mercor usually works in cases of gastrointestinal and urinary system. Merc dulcis works especially on the catarrh of the ears and ear and middle ear infections. And merc cyanide works on throat, and merc protoiodide works again on the throat. There are other two remedies which are not over here in Ellen's keynotes. Merc iod flavum, merc iod rubor. Again, those work on the throat. Then there is merc bin iodide. Again, it works on the throat. Then again, it is given merc solubilis. It works on the entire body. And there is merc sulphureus, which is mentioned in Ellen's keynotes. It works on the chest or the lung infections. So mercor, it is indicated in Bright's disease or patients who have syphilitic ulcers, corroding acrid pus. And we have dysentery and summer complaints of the intestinal canal occurring from May to November. Now, whenever our stalwarts have written some months in the books, in the remedies, always try to look where this author was located. In US, the timings of the seasons are different. In India, it's different. In Europe, it's different. So, try to find out, or else try to find out whether they have mentioned something about spring, summer, winter, autumn, etc. etc. Only then you will be able to accurately understand what and why this remedy should be given. Otherwise, you will just blindly give and you will get stuck up. So, one of the important things in mercor you should always remember, and that is tenesmus. How will the patient express tenesmus? Tenesmus will be expressed by them telling you that I had to go to pass the bowel, clear the bowels 3 times, 4 times. I had the urge, I went, I came back. Again I had the urge within a fraction of few seconds. I went, I came back. This is mercor for you, my dear friends. Tenesmus of rectum, not better by stool. In the bracket you have better by stool, nux vomica. I told you about it in the previous remedy. There is incessant, persistent stool, hot, scanty, bloody, slimy, offensive. Very rarely you will get a bloody stool in the patient's manifestations. But if it is too frequently and not better by stool, mercor. Better by stool, nux vomica. Stick to it. You will see 9 out of 10 cases getting better. One case may require something else, or it will at least palliate and give a clear picture to give you another remedy if you are not clear with your individualizing symptoms. There are shreds of mucous membrane and terrible cutting colicky pain. So there will be patients who will tell you that I am having lot of mucus that is going and I needed to strain so much. That is a part of tenesmus. Okay. Again, the same tenesmus is there in the bladder, with intense burning in the urethra, urine hot, burning, scanty, suppressed, and in drops with great pain, bloody, brown, brick dust sediment, albuminous. And gonorrhea, second stage, greenish discharge, aggravated at night, great burning and tenesmus. So very rarely we will see the sexual diseases in our clinics, but if you get a chance, you can give these deeper acting remedies, which is Medorrhina, mercor, thuja, and so on and so forth. Next remedy we have is merc dulcis. I already told you it acts on the ears. Catarrhal affections of mucous membranes, especially of the eyes and the ears. Very underprescribed. very rarely prescribed by homeopaths because they stick to pulsatilla, they will stick to Calimure. Calimure 6x is safe for everyone, but never they will be able to reach to mug dulcis. But if you get a chance and if you give it, you are going to see marvelous results. Let me explain you how. Catarrhal inflammation of the middle ear, Calimure is mentioned in brackets, so it's very similar. So wherever these remedies strike your mind, you should think of what was the complementary remedy mentioned in Allen or Boric or Clark, whichever book you are referring, or Fatak, and then look those remedies rather than just ignore and stick to your prejudices. Eustachian tube closed in mug dulcis, catarrhal deafness, and otorrhea in psoric children, deafness of old age. Again, the remedy mentioned in brackets is Calimure. Deafness and catarrhal affections of the nares, throat, pharynx, and from mercurial amalgam fillings. Okay, those who have had teeth surgeries or some operations done of the mouth. Diarrhea of children, stools grass green like chopped eggs, profuse, causing soreness of the anus. Acute affections of the prostate after maltreated stricture. So you have these patients who will resemble to you like chamomilla like stools, greenish stools. In those cases also you can give mug dulcis. So consider that you have a child who is less than 2 years old and he is crying, he is kind of little bit feverish. If you ask the mother what's happening, the mother will tell that he is constantly touching the ear. You know that there is dentition also happening, and there are green stools. Now if you go and check the dentition remedies, I don't know if mug dulcis is there or not, I never looked for it, but you have to match the components. Once you match these components, you will be able to be a better prescriber and ignore what your prejudices are. Suppose you were looking for dentition aggravates where mug dulcis is not there, but all the other symptoms are fitting for mug dulcis, you will give it and get the result. So that's the way forward for you to use Allen's keynotes, Boric, and all these simple books and take forward yourself and your practice. Next remedy we have is merc cyanide. Great weakness, extreme prostration, cannot stand up from weakness, malignant diphtheria, intense redness of fauces, and great difficulty of swallowing. As the name suggests, cyanide, we all know that it's used for poisoning and everything. So everything related to throat will happen. And it was indicated once upon a time in some sort of diphtheria which was very bad. It's eradicated now. Going further, we have mercurius protoiodide, diphtheria, throat affections, especially with the cervical and the parotid glands, and aggravated of the right side, aggravated by warm drinks and empty swallowing. So think about this remedy when you want to prescribe lachesis to the patient, but the only problem is that it is right side and not left side. So merc protoiodide can be taught. Tongue thick yellow coating at the base like Kali bichromicum which has golden yellow, or natrum phos which has dirty greenish grey coating at the base, or like natrum sulf. And there is a sexual disease which is Hunterian chancre which is mentioned for mercurius protoiodide. Going further, we have mercurius biniodide which is biniodide of mercury. Again, throat affections, diphtheria and glandular affections of the left side, fauces dark red, solids, liquids, painful when swallowing, exudation, slight, easily detached. So tuberculous pharyngitis, you can think of this remedy. And I think last but not the least, there is one more. So we come to merc solubilis, which is Hahnemann's soluble mercury. I already shared in the initial part that it has some traces of ammonia and nitrates. So it is not a pure mercurius preparation as we see, but nevertheless we'll just read out the symptoms. Nervous affections from suppressed discharges, especially in psoriatic patients, are suffocated as another remedy. Glandular and scrofulous affections of children. Otorrhea, bloody offensive discharges with stabbing and tearing pains. Aggravated right side, night and lying on the affected side. Furuncles and boils in the external meatus. Picric acid is one of the other remedies mentioned. Polypi and fungus excrescences in external meatus. Teucrium marum is the other remedy, and thuja is the other remedy mentioned. Epistaxis at night when coughing hangs in the dark clotted sting like a nose, from the nose like an icicle. Acrid nasal secretion having odor of old cheese, nostrils red or ulcerated, and there is some symptom for urinary system mentioned, which is for gonorrhea, which may not happen to land up in your clinic. You will, if you get a chance, it's in the primary stages like phimosis or paraphimosis. Think about mercurius, think about sulfur. They will give a relief, but you need to give very high potency like 10 m, 50 m, and cm. Only then you will see results. Otherwise, you are going to not touch the disease at all if you are giving 201 m. It's not at all happening. Gonorrhea, and then urging to urinate at night, intolerable burning in the forepart of the urethra, and there is a torpid character of the problem. And in the sexual system, we have that Hahnemann had given this remedy for syphilis and diseases of the genitourinary tract, and is rarely indicated if the tongue is dry. And in phimosis and paraphimosis, as I told you, you can think of mercurius and its group of compounds, especially those that act on the urinary system. There is disease of the skin in mercurius, intolerable biting, itching over the whole body as from insect bites, aggravated evening and from warmth of bed, and he feels better by scratching, pleasant on scratching. So you have aggravation from scratching, sulfur, better by scratching, merc salt. Okay, last remedy for today, merc sulphureus. Chest complaints, especially hydrothorax, if occurring from heart or liver disease. Dyspnea, has to sit, cannot lie down, extremities swollen, loose, watery, causing severe burning and soreness, burning in the chest. I have never prescribed, so it is just similar to arsenic, cinnabaris, digitalis and sulfur. And if it is giving a lot of diarrhea to the patient, and at that time there are chest complaints, think about merc sulphureus, just like arsenic can be found. So this is mentioned by Lippe. So we complete a larger chunk of remedies today, the mercurius group of compounds, and think about them when there is aggravation from perspiration, there is better by scratching, there is aggravation at night, and complaints which have developed immediately or rapidly into destructive phase where there is lot of mucus or yellowishness, thick discharges, and tending towards bloody discharges and destruction of mucous membrane. So that's all from me from the Allen's keynote study streak. It is day 12, and see you all tomorrow with next group of remedies and something which will help you all clinically and practically. So thank you all for joining.